Hello everybody, hi, this is Dr. Kachepa from Inwood Dental. In this case, I want to show you a case of receding gums. Typically we get a lot of questions from patients as to what receding gums are or what causes it, and then what they can do about it to prevent it from getting worse. Now, in this particular case, we had a patient that came in today, is a new patient, and then I saw that they had receding gums, and I asked them about their diet and their oral health, their oral habits at home, what kind of toothbrush they use. And I think I kind of narrowed it down as to what's causing this gum recession and then enamel erosion as well. So I'm going to just go in the mouth quickly, show you kind of what I'm talking about, and then some of the remedies that you can have to prevent it from getting worse, or even treating it, or just maintaining it in the current situation where it is. So in this case, I'm going to show you quickly. So here we have gums that are receding. If you look here, I'm going to get this little probe. We have here tooth number 19. It's receding. Let me see if I can put some light on that and we can show it a little better. Like that. Tooth 19 here is receding quite a bit on the buccal here. Tooth 20, it's receded quite a bit as well. Tooth 21 has receded quite a bit. A little bit here on 22 on the canine. Now, what you can do in this particular case, you can come in and you could do a filling here. You could put a filling here so that I think in this case is acidic food like fruits. Sometimes drinks that stay here in these gum lines, and then they end up receding the gums and then eroding away the enamel. So we can fit it in so it doesn't get worse. In other cases, we can pull this gum up to here so that we kind of stabilize the situation as well. So we would come in here and pull this gum to there, pull that gum to there, pull that gum to here. We have to do some prep work in advance before that. And then we have to also talk to the patient about their diet, like what kind of foods they're eating at home. If they're eating anything acidic, really acidic, then we want them to stop doing that. And then if they're using a really with strong bristles toothbrushes, we also want to tell them not to do that, because if you do this, this can get worse. Sometimes I've seen this to where like you end up needing a root canal here because this keeps going back inside the tooth. The same thing there. Sometimes if that doesn't fix, you can even you can put crowns on these, but typically these are due to diet, some kind of acidic food that's causing the erosion. If it's not diet, then it's going to be abrasive, something very abrasive, a behavior kind of thing where you're brushing your teeth too hard. So this is on this side. We have some as well on the other side here. If you come in, you'll be able to take a look. Same thing, not as severe on this side here, but certainly you can tell on this canine here that it's receded quite a bit. So we can pull this gum up to here so that it doesn't become sensitive. Now sometimes patients like this have a lot of sensitivity in their teeth. If they eat anything hot or cold, their teeth become very sensitive. Sometimes if they eat sweets, something sweet causes their teeth to be very sensitive. And then I want to kind of come up here. This side not as bad. And then if we roll, can you roll your head towards me just a little bit here? This side is a little bit also bad. But these are some of the remedies that we do. And then there's one more area I want to show on the lingual of these teeth. Turn your head slightly to the other side there, and if you can come if you can come from this angle with the camera and open up just a little bit for me. And on the lingual of these teeth here, you could see that just bring this right up there, just like that. Okay, right there. You can see on the lingual here, he's had quite a bit of recession now. He may not know this, but all of this gum here was supposed to be here, this gum here, and then that gum there. So we want to prevent this from getting worse. And typically, again, we want to pull this gum. We can pull it up here, or we just try to stabilize it where it is. We have the patient change their diet, or change their oral habits as to how they're maintaining their teeth at home. We always want you to brush your teeth every day. We always want you to floss your teeth every day. But then you don't want to be too using toothbrushes that are not correct. Just use some that have soft bristles on them. If you use one with a strong bristles, you can also get some electric toothbrushes, which can tell you whether you're brushing too hard or not. But this is a classic case of somebody that has receding gums. So you can come up here a little bit in the front as well. You can see that. But we want to stabilize this and so that it doesn't get worse, and that we end up doing other further work in the future. So thank you very much again. So if you have some receding gums and you need a dentist to do them for you, you can come here to us here at Inwood Dental. My name is Dr. Kachepa. I'd love to see you and your friends in our clinic. Okay, thanks, bye.